When it comes to cancer, the name of the game is early detections. Specifically, when it comes to lung cancer, most of the times when we do find a cancer, it's statistically the odds are that we found them in the later stages of the disease. What we have right now in terms of the new technology we're bringing into Lima Memorial is giving a tool for specialists in primary care to be able to identify those nodules that are found basically on incidental examinations. We find that, of course, the earlier the diagnosis, the much better chance the surgeons and the other specialists would be able to come in and remove the cancer or treat them much more effectively.
Well, they told me that I had cancer, so they did more tests, and that was 2 weeks of no rest, worry. You know, the tests were... Some of them were kind of scary. The hardest part was, it's still hard for me to talk about it, is when I would have had to tell my daughter. My mom's been gone 27 years and I still wish she was here. So I didn't want to leave this world. You know, I wanted to be here for her. She's my most important thing. And my grandchildren are the most important thing to me. That's all I have, is them. I wouldn't want them to hurt like that if I wasn't still here, because they're too young. I want to be here as long as I can for them. I love life. I love my friends and I love all my family. I would have missed them. When he said, because it's going to be okay, it's contained, to wake up after that, and it was the story. I was lucky to have to go through all that process or to just wait and be worried. I was worried and stressed, and a lot of people didn't think everybody thought I was handling it real good, but they weren't here when I was by myself.
Usually patients undergo a PET scan that shows a lighted lesion, and it is very frustrating if you cannot get to a small dark red spot and take a biopsy and the patient is worried whether I have cancer or not. So SuperDimension technology is an excellent alternative for us to get a biopsy in over, I think, about 65 to 75% of the cases. They can approach this lesion with this technology. I'm pretty excited to have this technology here. The impact it has on the community is like this. People who have already smoked, they'll have a low-dose CT, a small little lesion, and this SuperDimension technology can biopsy the lesion. Okay, what next? Once when the biopsy is done, we would ask the pulmonary physicians to put a marker there. So once when the lesion is marked, you can clearly see it on an X-ray or a CAT scan, and when you're breathing, you can see the marker moving. That's where the tumor is. And by this technology, you can even diagnose a tumor less than a centimeter, less than even half a centimeter, where your scope cannot approach. You can approach by this technique. So more cancers are diagnosed at an early stage, rather than wait till the tumor is big enough where the cure rates drop down to only 20% cure rates. That's where we get the patients.
As you know, this is a revolutionary technique and the latest technology where you can identify the cancer at very early stage. This is our navigation, this is more sophisticated, and then we can do the smallest lesions possible to diagnose early with less complications.
I was just a little bit shocked. The radiologist said at the first test that there was a lesion that looked like ground glass. He said that can be a very early stage. He wanted me to come back in 3 months, which I did. He said it had grown significantly and it was dark. And I thought, well, what do I do now? There was kind of a numbness. I did not really realize the significance until sometime after the surgery. I just knew I was apprehensive about surgery. I mean, what I do best anyway is worry and overanalyze. And before I knew it, it was out. And I was only in the hospital for 6 days. I did not need radiation or chemo, which is terrific. And I cannot remember who it was that told me that if I hadn't had that, I would not be here. That was a fast-moving cancer. That's what, boing, it certainly really hit me. I thought, well, I'm not only here, but I'm very much here. It means a lot to me, too, though, to get the word out, because I am so blessed. I have known people, I've known too many people who had to wait for a chest x-ray, and by then, in fact, I lost a friend only about 6 weeks ago who had told me over the years, well, there's no sign of cancer, they say I'm doing fine. I lost touch with her. I read her obituary 6 weeks ago.
If you have the technology to make it easier, find it early, think how many people we would save. And you could be sitting here like me, thinking that you were blessed and that you got a second chance at doing the things that you want to keep doing.
I was so blessed to be able to have a low-density CAT scan. And, of course, this new technology, if that can be the norm rather than having to wait for the chest x-ray, then we're pretty much got it licked, really. And that is the goal.
Overall, by catching a tumor at a very early stage, this exciting new technology will help physicians give higher cure rates and better quality of life for the community as a whole. It's pretty exciting.